call us for Meals on Wheels, and we say, you know, what's happening? You know, why do you need Meals on Wheels? And they start telling us about other issues that are going on, and we said, did you know there's this home care that could help you through Office for the Aging, or our personal emergency response buttons? You know, there's all different kinds of services. You know, people call us about cancer. They don't have enough insurance. We refer them to the Cancer Services Program. Parents of children with disabilities, will transfer them up to the health department's early intervention program. So really, if you're looking for a service to help you deal with some kind of health condition, or just be successful living in the community for a long time, call us. You know, we can send you information, we can directly link you to a provider. Sometimes we make internal referrals, so you call us for Meals on Wheels, you don't have to call another number. We make the referral right then and there.
That's terrific. You know, I saw something about a workshop or something coming up this next week or so. Is that something I should look into?
I'm not sure which workshop.
Something about long-term care?
Yes. Well, we have something going on the 25th of October. Have you? Is that what you're referring to?
That sounds about right.
Overseeing our New York Connects program is a long-term care council. These are members made up of consumers. Actually, Mort Flexer, who used to be on this station, was part of this committee. It also has some nursing homes, home health care. It has many of the county departments, including Department of Health, Aging, the County Executive's Office, anybody who has to deal with long-term care. And we have been in a planning process for the last 2 years to figure out.
Where is that going to be done?
This is going to be at Chautauqua Suites on October 25th from 10 a.m. to 12 p.m. We invite the public to come and hear the work that we've done, the plan we have developed. We want some comment on that so that we can go forward and get more money for the services that we don't have in this county.
Well,
Is there any cost to go to that?
No cost, and there will be refreshments. So we got a federal grant to do this planning 2 years ago, and because we got this federal grant, we are now open for federal money to help implement part of what is needed to make health care better in our county, and long-term care especially.
Thank you very much. Thank you, caller.
Thank you. Thank you very much.
Send me a stamped envelope. I'll give you a nice $5 off your dinner over at the Lakeview, the bottom of the hill, and that wonderful restaurant in
Okay, well, have a wonderful weekend. Thank you.
Okay, great. First of all, Marianne, I know you've taken cuts. They whacked you on the state level, they whacked you on the federal level, and even locally it looks like a whacking's coming along. And I want to congratulate you for actually continuing the services, working around the budget cuts you received, not only coming up, but in the past. You point out you've got a grant for this grant. They chopped most of the grants. So you lost the grant for the senior employment, as I recall. It has been reduced, yes. And so at any rate, you're doing a great job, you and your team over there, balancing a budget that actually works. You make that penny squeak when you pinch it, we'll put it that way. Now, one other question that's really on the minds of everybody, if you drive around the county, you see all these signs, Save Our Nursing Home. What's going on there? What do you think? What's the official position without getting into a tangle with Red Cross Cut? They're going to close. They're trying to sell our county nursing home.
Well, I think that's, you've just said the two words that are the crux of the issue. Selling the nursing home does not mean closing the nursing home.
Right. Okay.
And no one who is in the nursing home will be put out in the cold. That's number one.
No DRG on this one.
Yeah. For any of you who know the Absolute Care of Westfield, Dunkirk, that nursing home was sold a few years ago. It used to be called the Waters of Westfield. Those nursing homes were not closed. The residents were not put out in the cold. There was just a change of ownership. And I think that's the discussion that's happening. Should the county own the nursing home? And I'm not going to tell you yes or no. That's not my decision to make. But that's the debate that is, should the county own the nursing home or should it be owned by a private entity?
What's the difference, though? Now, there are a lot of people very upset and aggravated about this. They're smart enough to know they'll keep it going. But there is going to be a big difference between county ownership and independent ownership, evidently, and they're concerned about that.
I don't know. All the people that are allowed to own nursing homes are vetted very strongly by the Department of Health. You're just not allowed to say, oh, I want to own a nursing home and go and bid on it. And we have some wonderful private nursing homes in the county, Heritage Village, Lutheran Social Services. These are church-run organizations.
A bunch of Absolutes.
The Absolute is a privately, they're a for-profit, I think, entity. So there might be a little bit of difference if it's a for-profit or a not-for-profit.
Well, they're doing
so
well in Westfield.
I think that's the issue, and I don't know who would be potential candidates to buy the nursing home. But it is a buy or sell, and it has not, it's a do we want the county government to be owning the nursing home, or do we want a private business owning the nursing home?
Okay, enough said. I have a phone call. Good morning, caller.
Good morning, good morning.
What's up?
I have a question for your guest. If somebody is showing signs of not being able to take care of themselves, like, well, your parents probably aren't around anymore, but maybe an older sibling or something like that is showing signs of not being able to properly take care of themselves, and there's nobody to help. How would you go about, or can you go about, suggesting that, or facilitating his or her
Hurry up, we're out of time. 2 minutes.
Going into a nursing home.
Well, a nursing home is not the only option, I have to say. If you're concerned about what we call self-neglect, actually we have a caseworker, our elder abuse prevention caseworker, and even though you don't think of self-neglect as a type of elder abuse, it actually is housed under that.
Self-abuse, like what boys used to do.
Some people might be getting a little forgetful,
Yeah.
or maybe they're not taking their medicines properly. You really don't know what the cause is, and so it's, always you can call Office for the Aging. We will send out a caseworker, Jane Morris. She's a wonderful lady, and she just knows how to approach these people. We don't tell where we got the referral from. We just say, we're Office for the Aging. Somebody is concerned about you. We want to come out and talk to you and tell you a little bit about our services. Many times we can connect them with home care services or a lifeline or adult daycare, and they don't have to move out of their home, and they don't have to go to a nursing home if they can get the services that can kind of keep them on track in their home. Mm-hmm. If they have mental health issues, there are other services through Family Services of the Chautauqua region that we can refer them to. For somebody, so there's many reasons why they might be doing this. They might be depressed, they might have mixed up their medications, and if they're not controlling their diabetes, then their thinking processes are not well. You get them on a good nutrition.
So, in a nutshell, you call the Office of the Aging, they'll send somebody over, check it out, right?
That's right.
There you go.
You can call both, either number, New York Connects, or our General Office for the Aging numbers. We'll send somebody out to take a look at the situation.
Thank you, caller. Send me
Okay,
a stamped
thank you.
envelope. Yep. Big problem when you do have somebody, especially when their spouse is trying to take care of them. It's almost impossible for somebody who's 85, a woman, trying to take care of her husband, just to move him, among other things. So, yes, it's a good thing, and I hope that they do continue the funding for this sort of thing. I wanted to say again, in a nutshell, again, using that term, Greg Edwards is trying to help out in another way. We have to pay a quarter of the state of the cost of Medicare, which is half the state, and it's the only state now that has half the state's share of Medicaid being covered by a local farm community that hasn't even got the money. They used to trade crops, for God's sake. We haven't got the dough for this anymore. So he says, well, we're supposed to send them a big lot of money every month. Just don't send them the money, keep it. Think you'll get away with that?
I don't know. You know, we also are waiting for funds from. It's a good statement to make. I think it's the right statement to make.
Well, a lot of other counties have chimed in and said, we go with that. We got one
and
last call. Caller, you have 30 seconds.
I have 30 seconds. Well, good morning, Mary Ann. And
Good morning, Linda.
Reed. This is Linda. It's great to see you on the show again, Mary Ann.
Thank you.
And coming on such a lustery kind of dreary day. It's so nice to see you.
Caller, last comment, quick.
Thanks for coming on. Mary Ann talked about all the services with the Office for the Aging.
Okay.
Have a great week.
Thank you very much, caller. Send me a stamped envelope. I'll send you some $5 off the lake. Okay. They're telling me time is up, Mary Ann. Give you a couple of seconds of your own to close off. You're doing a great job, incidentally.
Thank you. And I know people are concerned about the budget, and we are not out of the woods. Really, as Reed said, the staff and I have, the staff has really been doing a wonderful job to keep our costs low and to increase our return on investment. But we really will not be able to withstand any further cuts without cutting out services. And so it's very important. In this last budget process, they had suggested $35,000 worth of cuts. It would have cost us $171,000 worth of services. And those are services to the well seniors, like the dining programs, senior employment, out-of-county medical transportation. So while these were rejected, nothing is off the table until the budget is passed.
Okay,
and so
okay,
please get your comments into your legislatures.
Dr. Mary Ann Spanos doing the job for us, and I hate to cut you off, but you're
That's
tough to
all
get
right.
rid of anyway, you know. Nice job. I wanted to say again, if you want to get in touch with her, the magic number is, again, 753-4471, and she'll be right on it, whatever your problem is that affects the seniors. I do want, especially HEAP, which is coming up, that's a fuel adjustment, which is there's still some money left. I don't know how long. I saw them moving a trailer down to the park, incidentally, and I said, what's that trailer for? And they said, it's a new Office for the Aging office. And I said, gee whiz, they're really cutting you to the bone, Mary Ann. Okay. I want to thank special, wonderful people who've done the job for us over the time. Chuck Kelsey, built and designed architecture and all the building of our beautiful new facility here in the old school. Devin Taylor, who did a lot of work on it too. Chris Burt, Randy Burt, Chris Ramaker, Jeff Zook, who's our top engineer, does a fantastic job. John Hamels and Dan Berg. Get out there and prepare for Thanksgiving. Put the little ghosties from the trees. Make sure the kids are safe though at night. Maybe go along with them so they don't get hit by a car. Be careful, drivers. It's that time of year, all the kids going to school. May all that is proud and true and noble abide with you. I'm Reed Powers.